So guys, if you've been following microbiology videos, we discussed about we are discussing about gram-positive organisms, and we discussed about gram-positive cocci, the first one, the staph cocci. About Staphylococcus, as you remember, is catalase positive, coagulase positive staph aureus, and they're coagulase negative organisms. So if you didn't watch it, go watch the previous video about gram-positive and catalase positive organisms. Now today, in this video, I want to discuss about catalase and negative organisms. So when the catalase test is done, some organisms that are catalase negative are Streptococci, which is catalase negative organism. So this Streptococcus can be further divided based on the hemolysis on blood agar. Now, based on hemolysis, we have alpha hemolysis, beta hemolysis, and gamma hemolysis. Now, whenever you see on blood agar, there is some partial kind of hemolysis, like it's partial, then it's alpha hemolysis. And if you see full hemolysis, then it's beta hemolysis. If you see full hemolysis, then it's beta hemolysis. And if there is no hemolysis, then it is gamma hemolysis. But one thing about gamma hemolysis is these organisms show no hemolysis, but then they grow in bile. Now this is very important, I want you to remember, because there will be questions based on this. So if you remember these key points, it will be very easy for you to answer these points. So let's talk about the alpha hemolysis first. And alpha hemolysis, the organisms are divided based on optogene sensitivity and bile. So first thing, if an organism is sensitive to optogene and also soluble in bile. So if an organism is soluble in bile and is sensitive to optogene, then you need to know the organism is Strep pneumoniae. This is a very important organism, so we'll be discussing first about this one. And the second thing I want you to remember is there are some organisms which are optogene resistant and bile insoluble, but they show the property of alpha hemolysis. So if the question shows you big stem, but the key points are like organism shows alpha hemolysis, but it is optogene resistant, or is bile insoluble organism, and then there's alpha hemolysis. So in your mind, this table should come, and the picture shows you clearly that this organism is Strep viridans. Could be Strep viridans or Strep mutans, but then Strep viridans is very important for us. So the first things first, we'll discuss about Strep pneumonia first. So let's talk about Strep pneumonia first. Streptococcus pneumoniae. Now Streptococcus pneumoniae, the first thing is, which organism is it? Is gram positive? Is it catalase positive? No, it's not catalase positive, it's catalase negative. What hemolysis does it show? It shows alpha hemolysis. Is it bile soluble? Yes, it is bile soluble. Is it optogene sensitive? Yes, it's optogene sensitive. So these are some of the key points you need to remember. And for Streptococcus pneumonia, the other most important thing is encapsulated organism. Encapsulated organism, because capsule causes the virulence. So how the infection or how the organism is capable of causing infection? Because of the capsule, and the encapsulated organism produce IgA protease, through which it causes infection. And what does Strep pneumonia cause? Why is it so important for us? So Strep pneumonia can cause conjunctivitis, otitis media. Otitis media is most common organism, and in children it's very common. So if you see a child with ear pain and ear discharge, and eustachian tube is blocked, the first thing that you need to know that the symptoms are of acute otitis media, and is child of 3 years or some sort of child age, then you need to remember yourself about Streptococcus pneumonia there. And the other thing is it causes pneumonia and sinusitis, inflammation of sinuses. So these are some of the diseases that are caused by Streptococcus pneumonia. Another things you need to remember for the Streptococcus pneumonia is lanceolate shaped or it's flame shaped organism, and it shows quelling reaction, and which is nothing but capsular swelling on serological reaction. This is quelling reaction. So the organism that shows quelling reaction, if in question stem there is something like quelling reaction positive organism and pneumonia types of symptoms are given, then you can straight away answer strep pneumonia. Or if the organism is flame shaped, then you can straight away answer, it's strep pneumonia. So this pneumococcal pneumonia, Streptococcus pneumonia, can also be called as pneumococcal pneumonia and is associated with rusty sputum. So the sputum that you see in this pneumonia patients, the color is rusty. And one thing about capsulated organisms, so I'll talk about capsulated organism in general microbiology videos, so you'll remember there, because there are different sort of organisms which are capsulated organisms, and it's very important for you to remember, because if a patient is underwent splenectomy and is now asplenia, this majority of these patients get infected with capsulated bacteria organisms. So one of the capsulated organisms now we are discussing is Streptococcus pneumonia. There is also other organism we will discuss further, which is Haemophilus influenza. That's also capsulated, and asplenia patients can be infected with these bacteria. So it's very important for us to remember these things. And then there's vaccine for Streptococcus pneumonia for some strains, which are PCV 13, 15, and 20, and polysaccharide PSSV 23. So these are vaccine strains for which strains of pneumococcal vaccines are now available. And sometimes if there is for acute otitis media, we can do cochlear implants, and the drug of choice is penicillin. I'll discuss the pharmacology for all these bacteria at the end of bacteriology videos, so please do subscribe and watch out for that video, so all your pharmacology and then the drug of choices and related, I'll be explaining antibacterial, antiparasital drugs there, and those which are applicable to which organisms, and those how do they work and their mechanism and their side effects. So I'll discuss it there, so I don't want to discuss much about pharmacology of bacteriology here. So basically this is it about strep pneumonia. I think if you know these key points of strep pneumonia, however the question stem be, you should be able to answering it. And sorry, I also forgot that the major thing of strep pneumonia is meningitis. If child is having headaches and photophobia and all those kind of confusion sort of symptoms, you need to know is the symptoms lead to meningitis, and one of the cause of meningitis is Streptococcus pneumonia. So that's all for Streptococcus pneumonia. Let's discuss the next organism. Now if you remember, we just finished talking about strep pneumonia, and we are going with the series of what organisms, guys? Alpha hemolysis showing strep organisms. So alpha hemolysis showing strep organisms which are bile soluble and optocin sensitive is Streptococcus pneumonia. Now we are talking about optocin resistant organisms and bile insoluble organisms. So whenever you see these points in the question, you need to remember this, like if it's bile insoluble and optocin resistant and it shows alpha hemolysis, then we are talking about strep viridans. Now why is strep viridans important is strep viridans, immediately you see this name, one word that you need to come into your head is infective endocarditis. So why is strep viridans so important for causing endocarditis is usually this live in mouth. So in the oral microbiota these are present. So whenever this strep mutans and strep mitis, these cause dental caries, and strep sanguinis causes Late onset prosthetic valve endocarditis. Late onset prosthetic valve endocarditis. So one thing I want you to remember, if you remember about endocarditis, we have discussed about endocarditis when we were talking about Staph aureus too. So if there is native valve endocarditis, if you see native valve endocarditis, then it is Staph aureus. But when you see a IV drug abuser and now he has endocarditis because of a microorganism, then you need to remember is again Staph aureus. And another thing about IV drug abuser and endocarditis and Staph aureus is mostly right-sided valve endocarditis. So, and if the same IV drug abuser, but then this time is left-sided valve. If the valve is left-sided, then the organism is Enterococcus again. When I am talking about Enterococcus, I will be discussing about IV drug abuse and left-sided valve endocarditis. But then since we are talking about endocarditis and related microorganisms, just I wanted to discuss that point here, so it will be all together at one place. Now, early prosthetic valve, if you remember, we discussed this yesterday. I talked about this in my previous video when I was talking about Staphylococcus organisms. When there is Staph epidermiditis, then it's early prosthetic valve endocarditis. If there is late prosthetic valve endocarditis, early and late in the sense, guys, in the sense of time after a prosthetic device is placed, and then there's prosthetic valve endocarditis. Through this prosthetic device, the endocarditis is happening. That's all. So if there's late prosthetic valve endocarditis, the organism is Strep sanguis. So I hope you remember Staph epidermiditis in this Strep sanguis. And as I said, Strep mutans and Strep mitis cause dental caries. That's a very important point for you to remember. If you see a dental caries and then there's some strep organism that's causing it, then it's viridans group Streptococci, and viridans group Streptococci has Strep mutans, Strep mitis, Strep sanguis, and then Strep viridans itself. So yeah, I think basically this covers all the things about Strep viridans group of organisms. Now let's discuss about the next organism. So guys, some of the things you just need to remember by your head. There is no some things I can tell you to how to remember or stuff, but then just need to remember if it's alpha hemolysis, then you need to also remember, oh yeah, they are optocin sensitive, and then there's optocin resistant organisms. So, and we spoke about these two. Now I want to speak about beta hemolysis showing Streptococcus. So in this beta hemolysis property showing Streptococcus, we can divide them based on bacitracin testing. Bacitracin. I think for this you can remember, beta hemolysis and BB. Whenever there is an organism that's showing beta hemolysis, then we do further testing of bacitracin sensitivity and PYR status. Now PYR is nothing but is an enzyme which just need to it's just useful for differentiating between organisms. So that's why you use this enzyme. For these organisms which are bacitracin sensitive are strep pyogenes. These are group A organisms of beta hemolysis. These are strep pyogenes. And there is group B which doesn't show, which are bacitracin resistant and doesn't show any activity with PYR enzyme test, is group B. And these group B organisms are Strep galacticae. So the first thing we'll discuss about strep pyogenes. So if you remember, strep pyogenes shows what? Beta hemolysis. For beta hemolysis organisms, we do bacitracin testing, and for bacitracin testing, this strep pyogenes is what? Is sensitive to bacitracin, whereas strep galacticae is resistant to bacitracin. Discuss about strep pyogenes. So when I'm writing strep pyogenes, I'm sure you need to able to answer some questions. So which organism are we talking about first? This is gram-positive cocci, Streptococcus. And in Streptococcus, we divided them into alpha hemolysis and beta hemolysis. And in beta hemolysis, some of the organisms are what? Bacitracin testing and bacitracin sensitive and bacitracin resistant. Is Streptococcus pyogenes, you need to know, is it bacitracin sensitive or resistant? And you need to remember, is bacitracin sensitive. So for strep pyogenes, since you know all of the factors now, let's start discussing about it. So Streptococcus pyogenes, why is it? This is one of the very important organisms in Streptococcus because the pyogenic symptoms of these are it causes pharyngitis, cellulitis. Now cellulitis is something that is important as an image perspective. Sometimes in surgery they can give you a description, or in dermatology they can give you a description of cellulitis, and then they want you to identify cellulitis, and the organism that is causing it is strep pyogenes. And then if there's honey crusted lesions of the skin, like you see the honey crust, and then the same kind of lesions on the skin, then is nothing but is called impetigo. So what's impetigo? Is honey crusted lesions of the skin. And then erysipelas. Erysipelas is some sort of rash. I'm sure you have idea of. If you are not aware of it, please do Google it and now search for the images of erysipelas. It's also very important. Sometimes a big stem can be given and the image of erysipelas is given, and then you need to able to identify the treatment of this Streptococcus pyogenes, or the mechanism of the drug. If you can't identify that this organism is strep pyogenes, if due to erysipelas, then you can't answer that question. So it's important for you to know images and then the organisms and then the pharmacology. So all together you can answer questions easy. So this is pyogenic symptoms. Now I'm talking about toxigenic symptoms. Scarlet fever. Now can you remember how the tongue of scarlet fever looks like? Yeah, you're right, it's strawberry tongue. It's also very important image. I want you to look after it if you don't know how strawberry tongue looks like. It's been asked several times in several examinations. I mean, nowadays they won't ask you directly, but then they could go around and ask regarding that topic, but then you need to be aware of it, so you'll be alert during the exam. And then toxic shock-like syndrome. I'm sure if you remember, if you watched my previous video, was toxic shock syndrome, in which organism did we read about is Staph aureus. And then we can see necrotizing fasciitis in the toxigenic symptoms of strep pyogenes. And then this is very, very important because it causes rheumatic fever and glomerulonephritis. When we're talking about India, a lot of children have rheumatic heart diseases, which can be because of rheumatic fever, and rheumatic fever is caused by what? Streptococcus pyogenes, and which is a group A streptococci of beta hemolysis streptococci. Okay, now the another important thing is, what is it? Does the virulence is because of M protein. M protein is the virulence factor of strep pyogenes. So what does M protein do? It inhibits phagocytosis. So through this, strep pyogenes evades the phagocytosis of host immune system, so further causing the infections. And then that's how we see acute rheumatic fever. So talking about key virulence factors, DNase and streptokinase and streptolysin O. These are the virulence factors of Streptococcus pyogenes. So what test that need to be done is ASO titer, so that through this test we can know if there is rheumatic fever or not, which is very important for us. And talking more about scarlet fever, with the scarlet fever, as I mentioned again, it shows strawberry tongue, and then sandpaper like body rash. So this video should cover most of the points about strep pyogenes. So if you see any of the symptoms of any of these diseases, then the first thing that need to come through your head is strep pyogenes organism. And now let's discuss about the next organism, Streptococcus agalacticae. So now let's discuss about group B Streptococcus, which is Strep agalacticae. Now if you remember, what is Strep agalacticae organism? Is it bacitracin sensitive or resistant? Is bacitracin resistant? For the bacitracin sensitive organism, we discussed that it is strep pyogenes. Now this one is Strep agalacticae. Now one thing is group B Strep agalacticae. You can remember B for babies. So whenever you see babies such as early age and late age of babies, and they have neonate and all the symptoms of meningitis, the organism that you need to think of is Strep agalacticae. So if there's a neonate that has meningitis, it could be early or late neonatal meningitis. The main thing that's causing them is group B Streptococcus, which is Streptococcus agalacticae. Normally, usually it causes, colonizes vagina, and it can cause pneumonia too. And as I discussed here, meningitis and also sepsis. Sepsis is nothing but bacterial infections, severe bacterial infections, and all these mainly in babies. So that's why group B is for babies, and it's CAMP test positive. Now what's the full form of CAMP test? CAMP test is Krishkin Atkin Munch Peterson test. It's the name of the author of the test. It's not cyclic AMP test positive or something like that. It's just the author's name is short form CAMP, and that's how CAMP test positive organism. And when you do HHT test for these organisms is positive. What is HHT test? Is hippurate hydrolysis test. Hippurate hydrolysis test. And there's something, we need to do vaginal swabs for 35 to 37 week pregnant women. So that can be served as screening for us for this organism, so we can, prevent infections of these organisms in babies through screening them for the swabs of vaginal swabs and tracing this organism. And if we see positive culture in the swab, what we can do is we can give intrapartum penicillin as prophylaxis for this organism. So that concludes our discussion on group B Streptococcus, which is Strep agalacticae. And if you remember these points, I'm sure you can answer most questions on group B Strep agalacticae. And now we'll discuss further organism of Streptococci, which is gamma hemolysis organisms. Now, as you see, we discussed about alpha hemolytic Streptococci, beta hemolytic Streptococci, and now gamma hemolytic Streptococci. Gamma hemolytic Streptococci again can be divided based on those organisms that can grow in 6.5% NaCl and PYR enzyme status. Now, as I said, PYR is an enzyme. It's just to differentiate organisms if this enzyme can show activity through this organism. So there are positive organisms, which is Enterococcus, faecalis, and then there is non-enterococcus organism which doesn't show PYR status, and that is a gamma hemolytic Streptococcus galalolyticus. This table itself can answer many of your questions during examination, because if you can remember this stuff, which are optogen sensitive, which are optogen resistant, which are bacitracin resistant, which are bacitracin sensitive, and which show gamma hemolysis, which can grow in 6.5% NaCl, and which are PYR status positive organisms, negative organisms, whatever the stem be, if they can give you these points, then you can answer them easily. If you can remember and put this table in your head, it would get easier for you. Now, Streptococcus galalolyticus, there are very few points we can discuss about this organism. This organism formerly or before was called as Strep bovis. Now what Strep bovis used to do is it causes cancer of the colon. So those patients who have Strep bovis endocarditis have higher risk of cancer of colon. So if you see cancer of colon patient who had endocarditis and they ask you for the organism, then you should think of Strep bovis, which is now Strep gallololyticus. It usually colonizes the gut. It's present in the gut and it can cause infective endocarditis. As I mentioned, when it causes infective endocarditis, these patients are at higher risk of cancer of colon. So that's what you need to remember regarding Streptococcus gallololyticus. And now talking about enterococci. Enterococci causes UTIs and biliary tract infections. These are like key major important points about this stuff. A gram-positive cocci that causes UTI and biliary tract infections and infective endocarditis. Then you need to remember about enterococci, and some clues they can provide in the question are the organism is positive to PYR, is non-hemolytic because it's gamma hemolysis, so there's no hemolysis. And now another major important thing is this vancomycin resistant enterococci, and for these organisms the treatment is linezolid. You need to remember this. This is a very repeated question and very important point to remember of enterococci. So another thing is enterococci is PYR status positive, right? And it can also grow in bile. So they can test you by saying there's a bile-soluble organism that is PYR positive, then you can easily remember then it's enterococci. Enterococci causes what? UTIs and then also biliary tract infections. So that's all about Streptococci in this video. I'm sure I have covered most of it. If I didn't cover some of the points, please do let me know in the comments. Thank you for watching.